Hey guys, it's Katie, and today I wanted to talk about COVID. I know not a lot of people want to talk about it. It's hard to get away from it, but I think it's really important because a year ago from today, everyone's lives just changed because of it. I was in the Philippines. It's one of the least vaccinated countries in the world right now, and I was very fortunate enough to be able to come back to the States this past year where life is pretty normal, or so it seemed until a few weeks ago, where I was contact traced from a friend who got COVID even though she was fully vaccinated. For me, that was kind of like, whoa. It was a very big reminder that even if you're fully vaccinated, you can still get this virus because it is still evolving. We have the Delta variant, we have the Lambda variant right now, and I really wanted to use my channel to continue encouraging you guys to stay diligent and to stay educated about this, because you guys know how important education is to me. To be honest, on a college campus, it's easy to forget. And I really don't want to be ignorant coming into this school semester. You know, no matter how excited I am that senior year, Cornell is reopening in person, I'm ecstatic. And we're of course taking the precautions of surveillance testing twice a week and masking indoors and everything, but there's so much we can still do to protect our community, and I really think now is not the time to lose that diligence. And I know some of you are probably wondering right now, like, Katie, what vaccine did your friend get? Or, you know, was she doing this, and that to stay diligent? And like, okay, I will give you some quick context before we get into the exciting part of this video where I actually get to interview Dr. Seema, who is a COVID expert. I'll let her introduce herself later, but she works at the Stanford Center for Health Education, and she is just, insert her credentials on screen. I'm so grateful that I will get to be able to talk to her and ask her some of your questions that I asked you guys on Instagram at AlohaKatieX to ask. So we'll get into that real quick, but first I will tell you the whole like COVID history that I have to put into perspective how this situation came about. I was fully vaccinated with Pfizer in April. Up until that point though, and even after, I've been taking vitamin C and just immune support supplements every day to try to, you know, get my physical health strong as possible. I've also been sleeping 7 to 8 hours every day. I drink a lot of water. I exercise like 4 to 5 times a week, and I think there's really no point in my life where I've been the most physically, mentally, emotionally, spiritually healthy, and that is because I arguably had the worst. I was at my lowest in 2020. A few weeks ago over the summer, I had a friend from Arkansas visit me. I saw her on Friday for like 20 minutes. We were outdoors, we were not masked. At that time, the CDC regulations were that if you were fully vaccinated, you didn't have to wear a mask, and you know, we were also outdoors, so we thought that was fine. Saturday, we also saw each other again an hour for a longer period of time. We got ice cream, also ate outdoors, but it was, you know, an extended period of time and we were pretty close. And you know, I thought all was good and well until the following Wednesday. She called me and she told me that she had gotten sick and that she had gotten COVID and she was in recovery. My first thought was like, are you okay? Like, you are fully vaccinated. She sounded like pretty sick, and she said she was not feeling well at all. Like, she was totally like out of it, even though she was fully vaccinated. I think it was Moderna. She just did not sound great. And of course, what followed after is, by the way, that means you have to quarantine right now because I saw you in the past few days and I could have exposed you to the virus. It just felt surreal in that moment. That Wednesday, I canceled all my plans. It was so sad. I was gonna go to like a cookout that Wednesday, but you know, nope. Like the second I thought that I might have had it, and I started freaking out, like getting really worried, not for myself, but rather for the people I might have infected in that span from Saturday to Wednesday, because I see a fair amount of people. My worst nightmare in my head is not getting it myself, but rather unknowingly giving it to someone else and having them spread it and, you know, affect someone who is immunocompromised, who is at a very vulnerable state. So I quarantined the rest of the night. Immediately that Thursday morning, I got tested, and I did it twice. So I did one saliva test and one swab test at Cornell, just to be safe because I wanted to make sure that it was okay. Also quarantined that Thursday. Friday morning, I get my results back, and thankfully I am not positive, but that whole experience was kind of like a big shock and very much like needed reminder, honestly, that there are variants mutating that are more contagious and that are more deadly. And you know, for context, literally that week I was thinking, oh, maybe I can go to EZU, like an EDM festival in New York City. But you know, after that I was like, I don't want to be going to any city. Like, I want to very much stay here in the Finger Lakes region and go like camping with like one other friend in the woods or whatever. Shortly after the next few weeks, I started to wear my mask super diligently again. Like, I would be the only person wearing a mask in a room of other people who weren't wearing masks sometimes, because I was just so conscious again, and I was, you know, again, I was more worried that I was going to spread it to someone, and so I always wore my mask. I started also testing twice a week again, even though they had lifted the requirement for students who were fully vaccinated. I still kept going. I started signing up again because I wanted to know and make sure that I was safe, because keeping yourself safe helps keep others in your community safe too. I just wanted to share this because it was a very big wake-up call for me, and I think it's an important wake-up call that I need to share on my channel specifically, because my past videos have admittedly been very normal. And I'm thankful that I have, you know, stayed safe for the entire summer. Praise God. I want to move on to the exciting part of the interview where we can actually hear an expert talk about this topic. I have a few questions myself that I want to ask, and I want the answers to be on my channel, and I want all you to be able to know these answers just as like a foundational understanding of what is going on in the pandemic right now. And I also got some of your questions from my Instagram that are a bit more relevant, or like a bit more like pressing to like current day news. I hope both of those will be really helpful for you guys. See you all on Zoom. Well, I would love if you could start by introducing yourself to my viewers and just tell them a little bit about yourself.
I'm Dr. Seema Yasmin. I'm a public health doctor. I work at Stanford, where I'm director of the Stanford Health Communication Initiative. As well as going to med school, I went to journalism school, so I also work as a medical journalist and especially as a medical analyst on TV news, talking about all things health and science, but these days mostly about COVID.
Wow, yeah, you are an icon. I'm, again, honored to be having you on my channel.
Well, thank you for having me.
I guess just jumping into some of my questions, why get vaccinated even if you can still get COVID?
Good question. Loads of people are asking it. Here's why. Because even if you get COVID, which is so much less likely to happen if you are vaccinated, the vaccine still really protects you from getting sick with COVID, getting very sick with COVID, ending up in hospital because you're that ill, and of course protecting you from dying from COVID-19. So the thing that I want people to remember is, as more Americans and more people in general get vaccinated, you know, tens of millions, hundreds of millions, we are of course going to hear about these breakthrough infections. You're going to hear, well, my teacher or my friend's parent, like this person got COVID, but they were fully vaccinated. So like, what even is the point? But the point is, first you're going to hear about those, because the more that get vaccinated, the higher those breakthrough numbers will be. But it's still really, really small relative to the number of people getting very sick with COVID and dying from COVID who were not vaccinated. So for example, right now in the States, there's about between 40,000 to 50,000 Americans who are in hospital sick with COVID-19, you know, sick enough that they need to be in there. 97 to 98% of them never got vaccinated. So that's the point of the vaccine. It's like the flu shot, to be honest. Hopefully most of us get flu shot every year. You can still get flu and feel really unlucky, like, man, that's not fair. I got the shot and I still got flu. But the thing is, your chances of getting sick with flu, chances of getting very sick, even the duration of your illness is reduced because you got the flu shot. So, you know, in one sentence, the COVID vaccine saves lives, and it keeps you out of hospital, hopefully keeps you from having something like long COVID too. That's the whole reason for getting vaccinated.
Right, and that's such a great way to put into picture, because, you know, it's so easy to think like you have 100 people and, you know, one person gets COVID and you're like, oh my gosh, I could be that one person, which, you know, which is like, it's possible, but then you forget like the 99 people who now won't get the virus because of it. Another question is, so when after exposure to COVID-19 can you start to spread the virus to other people?
So it can actually happen before you even realize that you're sick. So a person who has the coronavirus inside their body can start to spread it to other people about 2 days before they experience any symptoms at all. And they can be quite contagious at that point. So we want to be mindful of that, because up to like 1 in 5, and in some cases 1 in 3 people who has the coronavirus inside their body feels completely fine the whole time. So we're talking about people who are silent spreaders, right? And it's really frustrating, and probably the reason why we're in this situation with the pandemic going on so long, that you get this spread from people that feel good, they feel fine.
In that case, if you are asymptomatic, how do you recover?
So like I said, we need to be really mindful that many people are asymptomatic. Up to like 20 to maybe even like 30% will have the coronavirus in their body, feel completely fine, and be a silent spreader. The thing to remember is, if you test positive for COVID, but you feel okay, you still need to quarantine for 10 days after that positive test result. That's according to the CDC, and that's even if you are vaccinated. Especially with this Delta variant that's spreading, what we're seeing when you compare the Delta variant to the earlier versions of the coronavirus, there's a lot more of it that stays inside your body, inside your nose, inside your throat, even if you've been vaccinated. So that's why the CDC says you don't always have to quarantine if you are vaccinated and are not experiencing symptoms, but if you are experiencing symptoms, then you do need to.
That's a really helpful distinction, because I was in a similar position a few weeks ago when my friend got COVID. She was a breakthrough case and I had to quarantine, but I was looking, at the guidelines, and it was like, if you're not experiencing symptoms, like after you test negative, you can kind of go out and about. But I did have that like lingering doubt of like, wait, what if I kind of still have it? Like, what is that? Even though I'm not experiencing symptoms, I know that doesn't mean I don't have it.
Right, that's a really good point, and also important to check the guidelines. I know people get frustrated with this, and I understand why. It's like, oh, the rules keep changing. But the rules keep changing because the virus keeps changing, and the virus keeps changing because not enough of us are vaccinated, so it has a lot of opportunity to spread from one person to another. And it's when it keeps spreading, it spreads from more people to more people, that it has the chance of mutation occurring.
I totally agree. Do you have any tips to just stay healthy in general? Like, can general health, so just being mentally, spiritually, like physically healthy, contribute to that?
I think so, yeah. And I mean, we're in year 2 of a global pandemic. It takes a toll on you. People haven't been sleeping as well. People have insomnia, just the quality of their sleep's not great. It's so anxiety provoking, right? And we can't divorce mental health from overall health. It's so intertwined. And there's a ton of studies out there that shows that poor sleep quality or stress, it's not good for your immune system. So definitely think about eating really well, looking after yourself, having good conversations, getting counseling if you're able to access that, good sleep, working out, all of that stuff. But just bear in mind, that stuff is good, but none of it replaces getting vaccinated. None of it replaces wearing a mask, physical distancing, trying to socialize outdoors more than anything. Like, those things are still really important protective layers on top of doing all the stuff like your yoga, meditation, and trying to sleep well.
Would you recommend taking, I don't know, any daily supplements? Or I know at the start of the pandemic, a lot of people were like, you should go out and like get vitamin D, and those are some things I've been trying to integrate in my routine, with just walking more and like taking immune support, like vitamin C supplements, since February. So I don't know, how does that fit into a routine, and can things like that help?
So I've always come from the point of view that it makes more sense and it's better overall to get your minerals and all of your nutrients, even your micronutrients, from your diet. So ideally from eating your fresh fruits and your veggies and whole grains and things like that. I totally get it that some people feel like their diet's not up to scratch, and so they want to supplement it with pills. But with things like vitamin D, you really only need to take that if you've been tested by your doctor and told that your levels are low. So I don't have anything against people taking those things. I just worry that for some people it becomes a crutch, and they do all of that stuff instead of additionally doing the things like getting vaccinated, physical distancing. Do you know what I mean? So it's a balance. Like, definitely do the things that make you feel well, even if it's placebo effect, that you have a green smoothie, in the morning, and it just makes you feel like you did something to nourish yourself and look after yourself. That's great, but please don't do that in lieu of a vaccine. Get vaccinated too, and keep wearing your mask, especially while the Delta variant is spreading.
Well, those were all my questions, but now I'd love to ask some of the questions my viewers asked and wanted to ask you. So the first is, are there studies that prove booster shots will work against new COVID variants right now, like Delta and Lambda?
There are studies that show that the current 2-dose vaccines, so mostly the mRNA vaccines that a lot of Americans got, are about 85% effective against the Delta variant. So that's good news, right? But here's the thing that we have to bear in mind. The Delta variant is a lot more easy to spread from person to person compared to the previous strains of COVID that we were exposed to. In fact, the Delta variant looks to be about 2 to 3 times more transmissible. So we need a lot more people to be vaccinated overall versus tons of people getting a booster. There's this big debate going on right now in public health. I don't know whether you heard just today, the health emergency director at the World Health Organization said giving people booster shots is like throwing out life jackets to people who already have a life jacket on while leaving other people to drown. However, we live in the States, and today it was announced that from September 20th, Americans will be eligible for a third booster shot. And we do have data, as your viewer is asking about that. We have data from Israel showing the Pfizer vaccine's ability to prevent severe disease among older people who were first vaccinated in Israel back in January. It's declined a bit over time, that protectiveness of the vaccine. We also have data that came out of the Mayo Clinic last week, which found the effectiveness of the Pfizer vaccine against mild infections had dropped. So it still was really good at protecting against severe infections, which honestly is what I'm more worried about. But it's because of those kinds of studies that we're hearing countries like the UK and the US saying, nope, we don't care what you're saying, World Health Organization, we are going to boost the immunity of our citizens. So you'll keep hearing about this debate, but I think for many of us living in the West, we're going to keep seeing this big imbalance between who has access to no vaccine versus who has access to 3 doses of a vaccine.
So my viewers are also really international, and I know you mentioned a lot of this was for American vaccines that use the mRNA technology. So I'm wondering if you have any like similar advice for other vaccines, like AstraZeneca, Sinopharm, and others.
Yeah, so no, that's a great question. And you know what? Unfortunately, or fortunately, depending on which you got, the mRNA vaccines do look to be more protective against the Delta variant compared to the vaccines such as the Johnson & Johnson vaccine and the AstraZeneca vaccine. That's not to say that those vaccines are rubbish. They still offer protection. But these are the first mRNA vaccines that we've used for anything, right? The Pfizer one, the Moderna one that came along for COVID. And they kind of spoiled us a bit because the efficacy was so high. I don't know if you remember that as the vaccines were being developed, we didn't have anything yet. The benchmark for like what might get authorization from the FDA was something that was 50% effective because we're in a pandemic, we just need something that will offer some kind of protection. These mRNA vaccines came out the gate with 94.5% and 95% efficacy, and that kind of like set the benchmark. Then these other vaccines come along that use a bit more traditional kind of technology, and their efficacy is like in the 60s or 70 percentages, right? And it just makes it look so bad, but that's still good. It's just that it's not as great and it's not as protective now against the Delta variant too as the mRNA vaccine. So the AstraZeneca vaccine is said to be around 60 to 70% effective against the Delta variant. There was a paper that came out a few weeks ago that showed that. And then there was a study from New York University that showed the J&J vaccine seems to offer the least protection against the Delta variant. And I have heard of some scientists, in fact, who've got the J&J vaccine here in the States, but decided to get a booster with a different vaccine, so with an mRNA vaccine. And there is data that can be useful and a good strategy. So people that did not get an mRNA vaccine to begin with, getting a booster shot of an mRNA vaccine, there's studies that show that can be quite effective.
The conversations with even my peers changed, and we were arguing about like, did you get Pfizer or Moderna? And it was like a 1%.
You in.
Exactly, and I was like, this like off the charts. Like we are already like we got so much protection, but here we're like, nah, 94 versus 95%. Like,
right?
Okay. I guess on the note of taking 2 different vaccines, is that something that you would recommend? Because I have viewers who have taken, let's say, Sinopharm, J&J, and they're now considering taking an mRNA vaccine.
A lot of times with a booster, you get a different kind of shot to boost compared to what you got in your earlier shot. So that's just a strategy you've used in medicine before. The thing is, my advice will vary depending on exactly which country you are in, because different countries are rolling out different policies in terms of, well, what did you get for your first shot, your second shot, and now what will you get for your booster? But like I said, there is data out there where they looked at people who got a non-mRNA vaccine to begin with and then got boosted with an mRNA vaccine, and there was good protection. So hopefully we'll see more and more evidence of that, and we'll get better data to kind of inform what's the best strategy for boosting immunity.
I didn't know, first of all, that normally you do kind of like mix in different ones, if you will. So
you can do, yeah.
Okay, so it's safe? Can we say that?
It can be.
On another note, with more like protective gear, how effective is double masking or wearing face shields? Because my parents, when I came here, they gave me like 10 face shields and they were like, you have to wear a mask and face shields. And I was like,
Face shields on their own don't do much. I do not recommend that. I kind of cringe when I see people at the gym wearing them. What you need is a mask that covers your nose and your mouth, and ideally not a bandana, not just a single layer, but something at least like a surgical mask. An N95 obviously is the best, and an N95 that fits you well, meaning it has a really snug fit, a good seal, so that, for example, your glasses don't steam up when you're wearing the N95. If your glasses do steam up, that shows that there's not a good seal, air is getting kind of in and out there. So double masking just gives you that extra level of protection, especially if you haven't got access to an N95. But I'm glad you or your viewers asked this question, because I've noticed that with the Delta variant spreading, there's also like a lot of myths and hoaxes saying that masks don't work at all. And some of my friends who are like wellness influencers on Instagram have been hearing this a lot from their followers. So I want to clear that up. Masks still work against the Delta variant. They keep your germs in, they keep other people's germs out, but not a bandana, not a face shield. You really want something that snugly fits over the nose and the mouth.
Another question was, does COVID-19 live on surfaces? So, do we need to be disinfecting our groceries and packages? Because there was a time when I was back home and I had just arrived and my family was just like spraying all this like...
And Lysol over everything.
Yes, yes.
The coronavirus that causes COVID can linger on surfaces. However, that's not how most people are getting infected. The World Health Organization tells us the vast majority of COVID spread is happening when someone breathes in someone else's virus particles, when they're near that person is singing, laughing, breathing, talking. It's those virus particles spread by those aerosols. That's what's causing the majority of transmission, not surfaces. However, I am a germaphobe, and I will always say that disinfecting surfaces, especially like commonly touched things like door handles, light switches, things like that, it's a good idea. We're going into flu season, we're going into cold season, so it is a good idea, but I don't want to see people bleaching their cucumbers or putting detergent all over their cherries, because we saw poisonings happen at the beginning of the pandemic, because people were like dousing food that was going to go in their mouth imminently in all of these chemicals. So just rinse with water, use common sense, do disinfect surfaces, but be mindful. The way most of us are getting infected and getting sick with COVID is because we're breathing in virus particles from another person.
So on the note, I think the $1 million question right now is, how long do you think COVID will last?
I think the virus that causes COVID is going to be with us forever. However, that doesn't mean we're going to be living in a pandemic world forever. So 2009, we had a flu pandemic caused by H1N1 flu. It was bad. It wasn't as bad as this pandemic, but still, technically it was a flu pandemic. That flu is still around today. We could still be exposed to it this flu season. It just doesn't make us as sick, and it doesn't cause a pandemic anymore. So I think what's likely to happen is this coronavirus comes along. It's so different to what we've seen, causes this terrible, terrible pandemic. But after the pandemic is over, it doesn't necessarily go away. It just joins its four cousins, the other coronaviruses that cause respiratory infections that are milder. And I think it will stick around with us forever. We might live in a world where every year we go get our flu shot, but the flu shot is also a COVID shot.
I guess going back to the vaccines, another question I got, which I thought was pretty interesting, is do vaccines drive the evolution of more COVID variants?
No. What really drives the evolution of viral variants is people who are not vaccinated, because that's where the majority of spread is occurring. This is really a pandemic of the unvaccinated. And when someone is not vaccinated, their chance of getting infected is a lot higher. Their chance of spreading the virus to another person is a lot higher. And it's that point when the virus goes from one person to another that you're most likely to get the evolution of variants. The virus basically is always replicating, making more copies of itself. And when it does so, that's when it has the chance to create a change, a typo if you like, and create a mutant version of itself that could be a lot more contagious, a lot more deadly. So it's the overall spread of the virus that keeps happening from person to person. The pandemic keeps going on. That's what drives the evolution of new viral variants.
Another question was, is it true that vaccines only last 6 to 8 months? Like, what can we take away from that study in terms of like booster shots or maybe even new vaccines? Like, do we expect that?
Yeah, good question. So I think what we're learning as we go, right? Because we're still in a newish situation. We know the vaccines work well, but we're learning, well, in different kinds of people, and immunocompromised people and older people, how long does protection last? And certainly we have seen some studies that show after 8 months, there's still some protection. It doesn't go from like 95% to zero, but that it is dipping to the point that we're concerned, and that's why some countries are rolling out boosters. As time continues, we'll get even more data about exactly how much protection does the virus offer over time, and how does that differ in different groups of people. But for now, because we are seeing some of these data points about, well, waning immunity, lesser protection over time, that's why we're having these conversations about the booster shots.
I don't know if there are statistics for this already, but I think a lot of people are wondering, what's the probability of getting the Delta variant if you're vaccinated with like the mRNA vaccines, so Pfizer and Moderna?
So the protection against the Delta variant is better for the 2-dose mRNA vaccines. So with the regular, older version of COVID, those mRNA vaccines were giving us like a 95% efficacy roughly. And against the Delta variant, it's still between 80 to 90%. So it's still a good level of protection. But of course, we don't want any breakthrough infections. That's why we're saying still wear a mask, still do physical distancing, still try and socialize outdoors and be careful. But like I said, this is a pandemic of the unvaccinated. The chance of getting the Delta variant is so much higher for someone who hasn't received any vaccine at all. Those are 97 to 98% of the people who are winding up in hospital with COVID in the States.
So I'm starting classes next week. I know a lot of people are very excited for the upcoming semester. It almost feels like there is no pandemic going on sometimes on campus. So do you have any, like, I don't know, advice for students, like things you think like would be helpful for students to hear in this time in light of this?
I think even just keeping it simple and just remembering to wear a mask, trying to remember to do physical distancing as much as possible when you can, and still trying to keep your socializing to the outdoors if that's possible. If you live somewhere that isn't too cold already, or too cold in the next semester, then just bear those things in mind. And of course, make sure you're vaccinated. And if you're able, have those conversations with friends who are not vaccinated, but have them with compassion and empathy. Try and understand their point of view and see what information you can offer them that might make them reconsider their decision.
My last question is there anything we can do to help? Because I know there are a lot of, like, my peers are like, I wish I could do more than, like, of course, I think one thing is, getting vaccinated and doing things for yourself, but there are a lot of, I don't know, my friends are also like, is there a way we can like raise awareness or like start a project or like donate? Is there any way that we can kind of do our part and contribute to this pandemic ending?
For sure. I think this is one of those, it's such a historical moment. And, we often talk about, if I'd been alive during this other time when some terrible tragedy happened, if I'd been alive when this terrible thing was happening, I would have done this. And we're living through a moment like that now, where you can literally save a life by wearing your mask. Because you don't know who you're protecting from exposure. You might feel fine, but especially with the Delta variant, you may have a ton of the virus in the back of your throat, in the back of your nose. And you don't know how immunocompromised the person next to you in the post office line is, right? So just by remembering to wear your mask, to pull it up over your nose, make sure it's on properly, you can save a life just by doing that. And you make a good point about vaccines. Like, it's something that you do. It goes into your arm. It hurts you a little bit. But it's really a good neighborly act. Getting vaccinated for COVID, for flu, for measles, for pertussis, for all those things is actually like a civic duty, because it protects you, but it protects others around you, including the vulnerable, including those few people who just are not able to get vaccinated for medical reasons. So I think those are the things to do. And then of course have those conversations, because the thing that I study is a spread of health misinformation and disinformation. And there's really interesting studies that show when someone's exposed to like a ton of crap about vaccines or about masks online, they seem to be protected against believing the crap when they take it offline and have a conversation in real life with someone. Hey, I saw this tweet. Hey, I saw this TikTok that said, if masks don't work. Actually, by taking it offline, hopefully having a conversation with a lucid person, you get that correction. You get that correction in a way that really sticks with you. So, if you've got good data, you're armed with good information, try and broach those conversations with members of family. I mean, we all have them. I have family and friends who are not vaccinated yet. I don't think those people are lost causes. I don't think they're ignorant personally. I think we all just approach those decisions from different places, but we need to have those conversations because the people we love, for society overall, we want everyone to be protected and we want the freaking pandemic to end.
We do, we do. That was such an amazing conversation. Thank you so much, Dr. Seema. I'm so glad to have had you.
Oh, thanks so much. And this is the book I was referencing where I talk about like why we believe the weird stuff we believe. And when I was writing it, I was like, I think I'm going to have to write a confession chapter up front. Like the intro chapter is about the conspiracy theories that I used to believe. So I would definitely recommend checking that out because it came out during COVID, but I wrote it years before COVID. And it's about so many like flat tummy teas that are on Instagram, the influencers try and get us to take, or placenta pills or whatever. But it kind of gets to that psychology of, well, why would you believe that eating your placenta would cure depression, you know?
Right. And side note, I love that you write poetry too. You're If God is a virus. Right? Yeah.
Thank you. But it's great talking to you.
Yeah, thank you so much. Alrighty, well, that was the conversation. She is so cool. I know this video must have been so long that I totally came into the interview and I was like, it's gonna be an average 15-minute YouTube video, but I don't know, are we at like 30 minutes right now? Still, I think it's super important. I hope you guys learned a lot from it. Make sure to give this video a thumbs up, share it with your friends, especially if they are asking you questions like this. Subscribe. I will be starting college soon and I'm super excited to be vlogging senior year, my last year of college. And you know, I just hope we all make this semester the best we can. Let's stay safe. I will see you guys next week with another new video. Bye guys.